Well, hey there. Welcome to the fourth in our series of 8 blog and live Q&A sessions. My name is Matt Bobman, and I'm happy you're here with us. Before we get into questions, I want to take a quick second and remind everyone that our past live Q&As are up at the blog site, along with the last 3 great blog posts. So please go check those out if you haven't already. I also want to remind everyone that in just about 2 weeks, we have a new course, an online course called Evidence in Practice, and it's a comprehensive ACL rehab course, and it's going to be all online. The course is set up as a pay what you can price because I know that some people are still hurting from pandemic restrictions. We're also offering some giveaways. Our friends at Peak Force are giving away 2 handheld dynamometers. Friends at Owens Recovery Science are giving away 2 seats to blood flow restriction training courses. And Synaptech is going to give away a pair of strobe glasses, which is really cool. Anyone signed up by May 22nd can be eligible to win those. And tonight, I'm really lucky to be moderating this question and answer session with Jason Avedesian. Jason is a biomechanist. He's a PhD out of UNLV, and he's currently doing a postdoc fellowship at Emory's Sports Performance and Research Center, also known as SPARC. Jason, welcome to our humble little question and answer session.
Thanks for having me, Matt. I'm really excited to be here and talk about this. It's the role of, cognition and ACL injury is a very exciting, it's just very exciting. There's not a ton of data yet out there, a lot of theories being developed, but excited to push this information forward.
Yeah, it gives us an opportunity to have a nice hypothetical or hypothesis producing discussion. And,
absolutely.
Yeah. So before we get started, I would really like to hear about your about SPARC. I looked
Sure.
at the site today, and it looks like just a super cool place. And I've seen some of the posts on Twitter that you've been making, and it looks like you're helping build the facility. What's going on there?
Yeah. So the Sports Performance and Research Center was developed as a collaboration between Emory University and the Atlanta Falcons. Our facility is actually on the Falcons headquarters in Flowery Branch, Georgia, northeast Georgia, towards the Appalachian Mountains. But yeah, we emphasize in ACL injury and concussion. Specifically, those are 2 of the biggest epidemiological problems in all sporting participants. But we have a main emphasis in the adolescent athlete specifically, and we have every bell and whistle you could possibly imagine. Matt and I were discussing a little bit offline, but we have a motion capture space that is pretty unique, one of a kind. Houses I always get this number wrong, but it's close to 142 motion capture cameras, 80 of which are markered, and then the rest are markerless. So we're exploring some technologies there. But we also have 2 of the best MRI machines around, some 3T GE MRIs that we have specifically dedicated to research, and then a clinical MRI as well. But what's unique about this facility is that it acts as our research hub, but also we train athletes here as well. But we have on-site physical therapists, on-site clinicians, from a sports medicine, orthopedic standpoint. And it's really just a great building with a great research team. It's led by Dr. Greg Meyer. He's the director of SPARC. But we have some really awesome studies that are ongoing right now using immersive virtual reality and augmented reality technologies, simultaneously collecting lower extremity biomechanics with that as well. But we're really now exploring the brain physiological aspects of human movement. So one of our unique innovations that we have here at SPARC is that when we get people in an MRI, when you're in a hospital, when you're getting an MRI, you're typically told not to move, right? Like stay as still as possible. But we actually get people to move in the MRI. And so we're doing some lower extremity tasks while patients and athletes are being imaged, and trying to really understand some of the neural correlates to what actually is occurring during human movement. So we have some really just exciting research studies that are going on, and really trying to connect the brain and body behavior.
That's super cool. So you're looking at brains with the MRIs mostly?
Yes.
The MRI machines?
Yep.
Yeah. Why do you need two of them?
One is purely dedicated to research. It's actually basically connected to our biomechanics lab, and it's solely dedicated to all our research studies. And then we have a second one that's more clinical based for patients who are getting imaged, various things like that. So
that's awesome. That sounds like a dream.
Very cool. And that's one of the unique technologies that I hope to take advantage of during my postdoc is, more the neuroimaging, neurophysiological aspects of concussion, just brain function in general.
Yeah. So are you a biomechanist? Are you a neuro?
I am
neuroscientist. Okay.
I am. I'm a biomechanist by trade. My undergraduate degrees were from Michigan State University in mechanical engineering and kinesiology. I realized after probably a semester of mechanical engineering that I didn't want to do the whole automotive sort of thing, working on cars. Just wasn't interested in. I was always interested in athletics and sports. And then sort of kind of merge those two fields together in graduate school, which is basically what biomechanics is. It takes a lot of engineering principles and applies it to the human body for study of motion and things like that. Did a master's degree in biomechanics at Ball State University. And then my PhD, it's technically in interdisciplinary health sciences, but it has a biomechanics concentration. That's where the majority of my dissertation work was in lower extremity biomechanics.
Cool. All right. Well, right before we get into questions, I've been asking everyone so far, but I want to hear from you. What is attention? How do you define attention?
Ooh, that is a great question. To me, and I don't even know if we have a great answer for it, to be completely honest with you, but it's, to me, I guess it's just taking your mental processes and focusing it all on a given stimulus, whether that's a visual, auditory, or maybe it's multiple stimulus. It's something that, to me, when I think about it as someone who studies a lot of movement, I think of attention as something that causes you to act in your environment. So something that you're reacting to, or you're responding to, or you're even, in a sense, anticipating. So that's the best answer I can give you. That's a very tough question, though.
No, that's good. I'll have to go back and see what Harjeev and Meredith and Dave said.
That's okay.
All right. So the next question is, so I have a question about bandwidth. So what is, you mentioned this in the poster, what's the mechanism for bandwidth, and can it be improved with training?
Yeah, that's a great question. To be completely transparent, the concept of bandwidth is pretty theoretical in nature. To me, what bandwidth is, and again, it gets back to that attention. It's how much attention you're able to give a particular stimulus. And with this whole idea of a bandwidth, it's if you're doing a single task, like if you're having an athlete, they're tasked to just balance on one leg. A reasonably trained athlete can do that pretty well. Balance on one leg, they can do it for forever. But now have this athlete close one eye, or have this athlete now close one eye and start reciting numbers backwards, or have them memorize a play or something like that. You'll start to see most likely the balance starts to get worse. And so what's happening here is you're taking attention away from one task, and now it's competing with another task, whether that's a secondary motor task or a secondary cognitive task. So this idea of bandwidth is you only have so much attention that you can give to one task or multiple tasks. But when you start introducing multiple stimulus or multiple task demands, that bandwidth starts to fill up pretty rapidly. And so it's like the whole thing of why we don't text and drive. Right. You don't text and drive because as soon as you start giving attention to texting and typing out a tweet or anything like that, your driving performance gets worse because now you don't have the attention to scan the road and watch out for signs and things like that. So that's this whole idea of bandwidth. It's almost like filling up a cup of water. At some point, that cup is going to overspill because there's too much stimulus for you to respond to and react to.
So can you grow your bandwidth, or do you just get more efficient at the things that take up bandwidth, so it takes up less bandwidth?
I think both, honestly. I think you can definitely become more efficient in being able to, from like a visual standpoint, recognize an object or recognize multiple objects in space. That's what gets into some of these, more smartboard technologies, being able to train some of these concepts. But I think you can widen your bandwidth, but I think that also comes with training. I think the whole idea of widening and becoming more efficient actually go hand in hand. Because if you become more efficient and able to process something faster, you're able to allow now to direct your bandwidth and attention towards another stimulus or the subsequent one. So I think those two concepts go hand in hand. But it's a great question, and honestly, at this point, we don't really have an idea of how to measure that yet necessarily. Like, what's a quantifiable number to say, this athlete has a 10 on their bandwidth, and this athlete only has like a 4 on their bandwidth. Like, it's not like human movement where we can quantify like knee flexion and, forces and things like that, where it's a very theoretical concept. But, for the listeners that are out there, I think a good way to sort of learn more about this concept is looking at some of the dual task literature, and like gait and balance and things like that. And when you start imposing like a secondary cognitive or a secondary motor task, you tend to see the primary motor task degrade in a sense, whether it's stability or like slowing of cadence and walking. And so this is that idea of bandwidth. As you start imposing more tasks onto the main task, that main task actually starts to degrade because more attention is given towards a secondary task.
Okay, so dosing it like a secondary task it's not so easy to give it a number or quantity. It's more
right.
How badly do they degrade or whatever.
I suppose kind of the best way that we can measure it right now is comparing. Again, I'm thinking of this from like a motor performance standpoint, but comparing motor performance when it's just an isolated task. So walk back and forth in the clinic, and then we'll measure your gait speed and your cadence and your step width. Okay, now I want you to, recite numbers backwards, recite the months of the year backwards, memorize this play for me, memorize these numbers, and then we'll measure motor performance while you're doing that. And I guess that's, kind of a surrogate in terms of measuring that bandwidth. If an athlete can maintain that motor performance during that dual task, then their bandwidth is still relatively high. But if we start to see motor performance degrade, which we often do during dual tasks, then we can see that bandwidth start to get a little bit more narrow.
Now, so that you have some pretty great measurement tools in your facility. Are you guys doing that clinically with your rehab patients or your sports performance patients, doing dual tasks and then measuring motor performance?
At the moment, not yet. And that's sort of where I think our next research focus is going to be in terms of, if we do see deficits in like attention and, visual spatial processing, can we actually train this quality? And can we make these athletes more efficient on the field? Just due to time constraints, research constraints right now, we just don't have the bandwidth ourselves yet to be able to do that. But I think those are going to be next steps here at our lab. I mean, it's going concurrently along the lines of, if we can train the neuromuscular system, we want to try to train the neurocognitive system as well, because we think that would give us the best opportunities for successful interventions. And we can discuss a little bit more about what that potentially looks like too. Yeah.
Well, brings me to the next question, which is there a dose necessary to get some good effects with brain training? To your knowledge, is there research out there showing that?
There is. There's been a few studies. Gary Wilkerson conducted a study, I believe it was in 2017, in collegiate football athletes using a Dynavision smartboard. And there's been a couple studies. Actually, a lot of these studies have been done in baseball athletes, which, makes sense for batters and things like that. But using these smartboard technologies like Synaptic, Dynavision, technologies like that to actually train this, train the brain concept is, something that I talk about a lot. But the doses tends to be about 3 times a week 10 to 15 minutes per training session, and it can focus on specific neurocognitive modalities like visual spatial processing, multiple object tracking, things like that. But that's again, there's not a lot of data out there yet. But the study by Wilkerson did find that after like a 6-week intervention, a couple times a week, 10 to 15 minutes, athletes who tended to have that initial slow processing speed, quote unquote, tended to get faster over the intervention. And what was also unique is it was a 2-part study. They found that those who were initially slow actually tended to be at higher risk for lower extremity injuries. And so if we know that that's one possible risk factor and we can actually get targeted training to actually improve that quality, then we could potentially reduce the risk of injury as well.
Okay. So that study looked at motor performance?
Yes. Yeah. Oh no, that study purely looked at visual motor reaction time and its ability to associate with lower extremity injury, and also whether this was a trainable quality or not as well.
Okay.
So a 2-part study. I believe it was published in 2017 by Gary Wilkerson.
Okay, cool. Okay, question just came in. Any thoughts on the interaction between wearing stroboscopic goggles and utilizing an external focus?
Oh, that's a great question, actually. It sounds like a motor learning person asked that. So stroboscopic glasses, if people aren't familiar, it's essentially occluding vision at various frequencies. Again, the opaqueness of the vision can change based on the settings. But the interaction between external focus, which is focusing on your action of your movement as opposed to like internally your movement processes, that's a great question. I think it could lend itself to a more natural adoption of an external focus, because if your vision is partially occluded, it takes your focus away from internally what you're doing in your body movements and scanning the horizon, scanning in the environment, just being able to successfully navigate in the environment, whether you have to receive a ball or make a pass while you're wearing these strobe glasses. So I think it could be a way to naturally help an athlete adopt more of an external focus, kind of get them away from internally what I'm thinking about. I don't want to, ideally, we don't want our athletes to be thinking about, okay, how much are my knees flexing here? How much is my arm rotating when I'm doing a highly dynamic movement? We want them to be focusing on, what's present in front of them. And I think strobe glasses and strobe training could be a natural way to do that.
Another question came up about strobe glasses earlier, and that was, physiologically, what's happening when you train with strobe glasses?
So that's a great question. I don't think we actually know the answer to that necessarily, physiologically, in terms of what's happening with, clarities being decreased with vision versus full clarity. But essentially, with vision, we're taking this, light stimulus, converting it into electrical signals, and then our rods and cones are processing this visual information. But I think, with occluding vision, that sort of takes away part of that process, doesn't make it completely clear. But something that, because I was reading that question offline before the show, something that came to my mind is the effects of strobe glasses on the vestibular ocular motor reflex, and whether that does actually make any changes there. For those who are unfamiliar with that, it's essentially when your head is rapidly rotating, your eyes actually move in the opposite direction in order to, fixate on a visual target, whether it's something that's moving, something that's stationary. So something that actually is of interest to me, or just became, something that when reading that question, is how does that affect that reflex, and whether it changes it. I think it potentially could, in a way, make that
that's interesting
strategy more efficient in a sense.
Right, because it relies on your ability to lock on a specific object and then
fixate, and
then the reflex. And the reflex does the rest. That's interesting. That would be you could train that, I think, really easily, because I worked in a vestibular clinic for a while, and literally one of the things you do is you grab someone's head and you set a metronome to like, I don't know, 110 beats a minute or something, and you have them read while you're physically moving their head. It's kind of barbaric, but like from just like like standardizing a research for it could be pretty straightforward.
And that's something that they do, post concussion if athletes, individuals are complaining of vestibular issues, and that could be leading to prolonged symptoms, and it is a clinically trainable quality. And so I just when I read that question, I thought of that from that sort of aspect, because when you're moving around in a dynamic sporting environment, I mean, your head's moving quite a bit, whether you're a football athlete, basketball, soccer, what have you. You're running, jumping, cutting, your head's moving a lot, but you still have to fixate on a target or even multiple targets. So I think strobe glasses could potentially positively influence the ocular motor adaptations.
That's cool. Yeah, I have a couple neurotherapists in my clinic that do a lot of vestibular now. I don't do much anymore, but I'll have to ask them about it. Okay, here's a biomechanics question. So we see riskier biomechanics when doing divided attention tasks. Do the biomechanics improve with training?
That's a great question. At this point, there's not a lot in terms of training studies, in terms of training in a dual task environment and whether actual motor performance improves. But yeah, in the divided attention, unanticipated literature, we tend to see more of those quote unquote risky biomechanics. Again, that gets to the whole, bandwidth sort of thing. If you have to focus on, something in the visual field and not be able to focus on how much your knee bends during a jump landing, you're taking away some of that attention from the motor task and putting it onto, the secondary cognitive task. Some of the things that I've actually seen out in the field, and I talked to coaches quite a bit about this, and they're pretty unique in how they, design drills and different tasks like that, but they'll actually have their athletes complete like a Stroop task while they're doing like a dynamic cutting or running sort of task, to where, they'll run full speed and they'll flash a card really quickly and it'll say red, but it'll be in the letter green. And, based upon whether they're cueing the athlete to respond to the actual color of the letters or the color of the word, then they either cut to the left or cut to the right. And so it's in a sense, attempting to train this dual tasking, because where, they're performing a highly dynamic motor task, but now they have to, rapidly relay this visual information and also take some working memory concepts in there, as well as remembering, am I supposed to respond to the letter? Am I supposed to respond to the color? And then correctly performing the task, whether I'm cutting in the correct direction to the left, whether it's the color, or the correct direction to the right, whether it's the word. Again, there's not really hard set data out there to say like this is the way to train dual tasking. But I think with technologies like strobe glasses, with technologies or just innovative practices such as, having athletes react to unanticipated conditions, I think are probably the best bet that we have right now until we actually have more hard proof data.
Yeah. A Stroop task is hard by itself, just sitting in a chair.
Absolutely. Yeah. I've done a couple computerized ones and they're tough, but then imagine, telling an athlete to, respond to 4 different stimulus. But in a way, I mean, we think that's hard, but that's what athletes are required to do oftentimes in sports. We take for granted, and I kind of alluded to this in the blog post, but we take for granted how challenging a sporting environment really is. And there's so many, stimulus, visual, auditory, stimulus that, that are distracting, attracting an athlete, but then they also have to make these really complex motor tasks, jumping and landing on a single leg, jump cutting, decelerating, accelerating. And athletes do it extremely well. We just, as researchers and clinicians, we focus on, the events that do lead to injury. But if you think about it from a standpoint, most athletic events don't lead to injury 99% of the time. It's just that 1% we have an ACL tear or different, sorts of injuries. Those are what we focus on. But athletes do it very well in a sense. And it's, studying it from a biomechanical standpoint and then now trying to transition a little bit more into more of the brain and neurophysiological aspects, it's pretty amazing how we're able to do these complex tasks relatively automatic from a viewer standpoint.
Yeah, super interesting. Let me ask you, I want to ask you about sensory motor errors in integration.
Sure.
A few of those, and then I'm going to ask you about concussions here. Well, let me ask you, is the idea of a non-contact ACL injury being the result of a sensory motor integration error settled? Is that, can we say, yeah, we're done, researchers know this, let's move on?
Absolutely not. Absolutely not. I think with ACL injuries, I mean, even some of the things like dynamic knee valgus, which have been studied for the past 20, 30 years, I still don't think we have definitive, this is it. We know it's one mechanism, but especially when you're talking about the ACL, because of, how complex this injury really is and how multifactorial it is, being able to say that it's one sort of risk factor or one sort of perspective, I think kind of cuts it short a little bit for, how complex the injury is. But with the sensory motor aspect, it gets into this idea of, the bandwidth is that, what sensory motor is, a sensation that we take afferent information and then, efferently we create a motor action. We respond to it, or we're predicting a motor behavior based on what we think the stimulus or the sensation is going to be. And this idea of, a non-contact ACL injury being, attributed to errors in sensory motor integration, I think starts from, the very hierarchy, the very top of slowly processing the sensory information, not processing sensory information fast enough. And, one of the figures that I drew in there, again, it's more of a theoretical, type of figure, but something that I've thought about a lot when really studying this topic is that if we're slow to process this sensory information, it potentially leads to a mismatch in, perception action. And if we have this mismatch into, what we're perceiving is to what we actually should be doing, that could lead to, a delayed, neuromuscular response. It's, to give just a quick aside, one of the studies that I did in terms of sport-related concussion were in adolescent athletes, and they performed some drop landing tests, pretty standardized, from a 30 centimeter, 60 centimeter box. And what we were finding is that these athletes who have had prior concussion histories tended to land more stiffly, stiffer sagittal plane motion, less knee flexion compared to controls. And when really thinking about it, the more I thought about it was more of a potentially a perception action mismatch. They misjudged how much flexion of the lower extremity they really needed in order to, attenuate these landing forces. And so that's kind of what I mean by a perception action mismatch. Your action actually doesn't match what it needs to be, or your perception of what the action just doesn't quite match, and that can lead to a delayed neuromuscular response, whether that's decreased quadricep activation or decreased frontal plane stabilizers. And then what happens there is the knee joint in this case becomes potentially more unstable in a dynamic task, and that can increase loading onto the tissue surrounding the knee, the ACL itself, and then we could potentially have an injurious situation. So that's kind of what I mean in terms of it's an error in sensory motor integration, but with the caveat being that ACL injury is very, very complex. It's probably one of the most complex structures in the whole human body in terms of the tissue and what it's able to do and what it's able to withstand. And so we've done a lot of research in ACL and ACL injury, risk factors and prevention, but the bottom line is ACL injuries are still relatively high in a lot of sporting populations, and they have a lot of debilitating effects afterwards, long term. And so we're still trying to understand, this injury and what truly is an ACL injury from a non-contact sense. Contact ACL injuries are a little bit different.
Yeah, and it's kind of like a black mark on rehab people too, that the re-tear rate's so high. I think it's not good.
Well, I mean, that kind of gets into, again, more of the cognitive aspects of ACL and ACL injury itself. Some of the work that Dusty Grooms has done recently and the neuroplastic alterations that occur post ACL. I mean, the ACL holds one of the largest. It's one of the largest mechanoreceptor structures in the lower extremity. I mean, just think about how movement would be if you didn't have an ACL. I mean, there are actually a few athletes that there was an NBA player in the mid 2000s who played without basically any ACLs. But I mean, just think about if we took the ACL away from somebody who's had a functioning, healthy ACL, and I would imagine it'd be a lot more difficult because it's just the mechanoreceptors and the proprioceptive aspects of this structure.
Yeah. So. Yeah, Dave Sherman last one of these he referred to the knee as the largest sensory organ in the body, including all the surrounding tissues. I thought it was really interesting. And and then Meredith in one of our talks, I think she described the your ACL injury as being an ACL injured person she said like a broken sensory motor system, which kind of stuck with me as an idea.
Yeah, no, I think I would completely agree with both of those. They both are very smart individuals and wrote some great posts as well on this. I mean, if you think about it, I've actually, since I've been a postdoc here, I've been one of the lab rats for the imaging, just piloting our imaging protocols. And I had my knee imaged a month or two ago, and I actually got to see the image of the ACL. And it's amazing how much research and just hard thinking and just conceptualizing that we do for such a small structure, but how just important it is to athletes and, for function and health. It's just amazing how much money and research has gone into such a small part of the human body.
Definitely. So you talked about processing speed. So if processing speed is really the issue, if we had enough time to make a better movement decision, could we avoid an injury? And then I'm going to also ask you how, because I saw this on your, I watched your PhD defense, and I'm pretty sure you mentioned how quickly ACLs tear and how quickly, and then how does that compare to conscious awareness of that external moment on the knee?
Yeah, absolutely. Going back to the first question, if we did have enough time, I would say in most circumstances, yes, we could avoid that situation. And that could even lend itself into contact injuries too. If we had enough time, we could avoid a contact situation altogether. If one of the examples that I gave in the post was like a running back. If they had enough time to process the information, process what the defenders are doing, then obviously they could avoid the defenders and avoid, an injury situation altogether. But we know from, dynamic sports, there's these pretty significant, temporal constraints. Things are happening very rapidly. Some research that I was reading pretty recently in soccer, more of the elite level World Cup, English Premier League level, ball speed has gone significantly faster, and players are sprinting more now than they have in previous decades. So the game just itself is getting faster, and that's probably extending to most sports as well. Athletes are bigger, stronger, faster now. That's the mantra that we always want, though, and that's fine and great. But as the neurocognitive processes actually keeping up to date with the physical processes of these athletes. But yeah, to answer the first question, I would say if we had enough time to choose an appropriate motor performance or a motor strategy, we would tend to avoid the injurious situation. Matt, could you go kind of to the second part there? Sorry.
Yeah, I was just, how quickly does an ACL tear, and what is conscious awareness? Like how fast can we become aware of an external moment on our knee?
Yep, absolutely. So an ACL, from some of the data that's out there, from the moment that the foot hits the ground, tears in about 40 to 80 milliseconds of ground contact, which is very, very rapid. Conscious awareness of a stimulus is actually after that fact. Tends to be about 130 milliseconds afterwards. And so this gets into the part of, this idea of a sensory motor integration error for ACL injury, where if we're able to perceive and almost predict a stimulus, we can make that appropriate. And I've alluded to this in the post as well. This idea of a feed-forward neuromuscular response. It's priming the tissues around the ACL, around the structures of the knee, to be able to handle those loads, because you can't be consciously aware of when an ACL injury is actually happening. By the time you realize that it already happened, 40 to 60 to 80 milliseconds is just below, when a tactile stimulus hits that our brain can actually register. We're just not fast enough. And so that gets into the idea of sensory motor integration, is that if we're fast enough to perceive and anticipate an oncoming stimulus or various stimuli, we can make those appropriate neuromuscular adaptations and neuromuscular protective responses, quadricep contraction, hamstring contraction, co-contraction strategies, and avoid that injuries, ACL situation altogether.
Yeah. I mean, first thought with that is we're screwed. That's and the second thought is I think that it's like the training, more than like preventing, you're just like throwing everything you can to help this athlete minimize risk, with those numbers in mind.
And I mean, if you think about it from just a neuromuscular standpoint, like the idea of neuromuscular training in and of itself is to have the tissue be able to respond to high loads. I mean, I'm sure there are situations to where an athlete didn't anticipate a stimulus fast enough. They just weren't quick enough to respond to something. And they put their knee in a situation where the risk of injury could have been relatively high. But if they had enough strength and the stabilizers of the knee, they avoided that situation in the first, there's just not enough strain was imparted onto the ACL, and they avoided an ACL injury. I'm sure there's been situations like that where from a neurocognitive standpoint, they were slow, or, they didn't respond to a stimulus fast enough. They didn't anticipate something fast enough, but they had, sort of a reserve there from the neuromuscular standpoint. We're just trying to understand, can we get athletes fast enough from a, response or reaction time to where they don't even have to necessarily rely on that neuromuscular. The neuromuscular is great and it's absolutely needed. But that's kind of a last ditch thing at this point. If you're, slow and you have a high load on a single limb, you better hope your lower extremity, your hip abductors, your quadriceps and hamstrings are strong enough, or else, that force, that landing cutting force gets put onto the ACL and ultimately, leads to a rupture.
Yeah. All right. Concussion. So in the 2007 Swanwick study, they used impact and ACL injury. How causal was the testing deemed to be, and should athletes get this test prior to each season, specifically for maybe like ACL or lower extremity musculoskeletal injury risk?
In terms of causal, I wouldn't necessarily really even call it a causal relationship. Basically, the gist of that study, which is really one of the first to really report any sort of like neurocognitive aspects of lower extremity ACL injury. This was done in 2007, and then we kind of had a little lull or not much data, and now we're starting to see a little bit more come out. But essentially, the findings of that study were they had a cohort of college athletes who they all took baseline impact testing. And they matched 150 athletes, non-contact ACL injuries during the season, matched them to a control group who didn't go on to sustain an ACL injury. And what they found there was that the athletes who did go on to sustain a non-contact ACL injury performed worse on reaction time, visual motor processing speed, verbal memory, and visual memory. At baseline, this is pre-injury, and so this kind of led to some of the research that I'm doing now. I read that paper and some of Buzz Swanick's papers all the time. Brains and Sprains is one of his other papers from 2015 that I would highly recommend if people want to read more about this. But it gets into this idea of if an athlete has relatively slow, processing speed, reaction time, visual spatial attention. And they don't have, the requisite neuromuscular strength to be able to handle this landing or cutting force. then they might be at a higher risk for an ACL injury compared to someone who is, faster processing speed, is able to, react to a stimulus more rapidly and avoid this injury situation. The next question that was brought up about whether all athletes should do this is actually a very interesting one, and one that I actually published on pretty recently. American Journal of Sports Medicine came out about a month or two ago. It was a systematic review on the influence of cognition, neurocognitive performance on lower extremity injury. It was it wasn't ACL specific, it was just lower extremities itself. And what I found from this review is that it was a two-part one. One, it was a review on cognition and lower extremity biomechanics. And the second part was neurocognitive performance in actual lower extremity injury and injury risk. And essentially what I found was that athletes who had slower reaction times, slower processing speeds, tended to demonstrate biomechanical patterns that would be more associated with a higher risk of ACL injury, higher landing forces, greater knee valgus. And then the second finding was that, in the Swanek paper was one that I cited and discussed in that paper, was that athletes who were, worse on neurocognitive indices of reaction time, working memory, visual spatial attention, were at higher risk for injury compared to athletes who are faster on these types of tests. And there was a couple different ones. Impact was one. Synaptic was another. Dynavision, the Dynavision smartboard. But yeah, those were the main findings. And it kind of what I concluded from that review is that neurocognitive testing doesn't necessarily have to be impact. We know that there's some limitations with impact and any sort of computerized assessment. There's going to be learning curves and the generalizability to a dynamic environment, but it could be used for dual clinical purposes of one, concussion management, because we know that's a pillar of concussion management is neurocognitive assessment, and two, potentially has clinical utility for identifying athletes who may be at higher risk for lower extremity injury.
Okay, so these are the systematic review and the Swanek study from 2007. Those are non-concussed athletes, right?
Yeah. I should have mentioned that. Those were non-concussed individuals, and my systematic review was in individuals who did not have a concussion history.
Well, tell us about concussion in lower extremity biomechanics.
Sure. Yeah, absolutely. And that's really what got me started in kind of, this area of research. What we tend to be seeing now in the literature is that athletes who have had a history of concussion, could be multiple, could be single concussion, tend to be at higher risk for lower extremity injuries. Ankle and knee injuries specifically, there's actually only been one paper that was published by one of my colleagues, April McPherson. She published a paper on individuals who have had a concussion history. We're at about, I don't want to give an incorrect statement, but they were at higher risk for ACL injury, essentially, compared to individuals who didn't have prior concussion history. That's been the only paper that I've seen so far. Directly,
who's the author?
April McPherson. Yep, McPherson et al. That was the only paper that's been linking directly concussion and ACL specifically, but overall, there's probably been now close to 15 to 20 papers that have looked at the relationship between concussion and lower extremity injury. And we tend to see post-concussion up to about a year after the injury, athletes are around about a 2 times greater risk for lower extremity injury compared to athletes who haven't sustained any prior concussions, or compared to their pre-concussion injury incidence rates. So, and that's where my dissertation work kind of came in with looking at some of the biomechanical aspects of the lower extremity in athletes who have had prior concussion histories, in adolescent and collegiate athletes. And one of my main findings was that we tended to see less sagittal plane range of motion during jump landing, jump cutting tasks in athletes who have had prior concussion histories.
Huh. That's really interesting. So you know what? This sort of makes me think of. Have you ever read anything by Oliver Sacks?
Not really, no.
Oh gosh, you should. He's a very good author. But one of the things that he's done, he's a neurologist. He's passed away now, but he would do these really interesting case studies or case histories, and he would basically find these really unique people who've had a specific part of the brain injured or certain things that really can give you a lot of insight into what that function might do.
Right.
And I sort of think of like, concussion is sort of bringing this to mind because like, you have this sort of like N of one of a person who's had a head injury and it has these effects, and you can probably learn a lot. Like, how do we process information? Like what systems are dysfunctional when you're, in your brain due to the concussion versus a healthy individual. And is that kind of what is that characterization, right? Yeah,
absolutely. I mean, the way I sort of think of, the relationship between concussion and lower extremity injury is that, concussion is, classically defined as like a temporary altered cognitive state. That's one of the hallmarks of the injury, headache, I perform worse, neurocognitively on, my impact or my whatever sort of neurocognitive assessment. And that, that tends to resolve after a week or two. Athletes return back to baseline. But the question becomes now, is there some sort of lingering deficit there, whether it's, a sensory motor deficit, that when an athlete does get back onto the field after their concussion, and again, they've cleared all their medical exams, they've been clinically cleared to participate, what's, the underlying mechanism as to why they might be at higher risk for injury? Because we've seen, a lot of data out now. There was one study in the military, actually, from 2018. It had 25,000 soldiers, half of which had a concussion matched to half that didn't. And they found the highest risk for lower extremity injury was about 15 months after the initial concussive event. And so it's not just in athletes either. It's also, in the military, which is another big population that sustains a lot of head injuries. But we're seeing that even in the military population, which is a different environment than a sporting population. And so if we're seeing it in different populations now, there's some potentially underlying mechanism, from a sensory motor neurocognitive standpoint, a deficit that still might be there that isn't being revealed until, these athletes or these soldiers have to make really complex, highly dynamic decisions that might not just be tested in the clinical setting at this point. So I think it's a question about that. And it's something that, that's driving my research interest right now in terms of what we can do in a clinical setting that can, as best as we can, replicate, what an athlete, what a military personnel will actually see on the field. So, and we have some cool technology with, if I can just make a little spark plug, with virtual reality. One of our studies we have right now ongoing is, depending on the sport that they play, we put them in a sport-specific immersive environment. So if it's a soccer, I've tweeted about this. I have some videos out there if people want to go look at them. But they're very cool where if it's a soccer environment, we have them do a heading task and like a defending task. If it's a basketball, it's a rebounding drill and defending a fast break, different things like that. So technologies like virtual reality, augmented reality can give us ways as researchers to better study athletes in an environment that's similar to what they actually would see in sport. And if we can study movement under those conditions, that gives us a better idea of, is this athlete actually ready to return to sport? I've actually had a couple conversations with the clinicians here about the use of virtual reality in ACL injured populations. In that initial, first couple of weeks, the first couple of months when activity levels are relatively low, having these individuals go through immersive environments like that, would that potentially be beneficial to them? So there's a lot of exciting technologies that we're currently investigating at Spark that I think could potentially be helpful from like a neurocognitive sensory motor standpoint.
Yeah, that's awesome. So we know, concussion will affect neurocognitive performance. Are there some others that are out there that like we all experiencing, like caffeine or lack of sleep, And if so, how can we standardize testing?
Yeah, and that's actually a great question when it comes to neurocognitive testing performance, like baseline performance. Some of the I guess the best way to call them is like risk factors for relative declines in neurocognitive performance, like high stress, a poor night of sleep the night before. Just like, I mean, we've all had it. We've had a bad night of sleep, and then if we have to or we have to cram for an exam, that feeling of that morning of like 8 a.m. you have to go take a test, and it's hard to remember all the terms that you memorize. But there are definitely some specific psychosocial factors that would influence neurocognitive testing. Bad night of sleep, high stress, even injury itself could affect that. Not just concussion. ACL, lower extremity injuries can definitely have an effect on neurocognitive performance. And I guess the best way to standardize that is having background information on the athlete prior to when they're doing a test that day. What's their stress levels? Did they have a bad night of sleep the night before? How's school performance? How's family at home? Because those are all stressors, both externally and internally, that can affect neurocognitive performance and affect the sensitivity of the actual data, because that might not be their true representation of their neurocognitive performance that day. It could just be affected by other factors.
Yeah,
but that's a great question. What's that, Matt? I said it's a great question. It's a great clinical question too. Sorry.
That's okay. I was going to ask if you're able to control for that stuff in research.
You can, in the sense of, if you're running like statistical models, you can control for the sleep, the amount of sleep the night before, and see if sleep actually does have a co-varying effect on neurocognitive performance. So there is a way from a research perspective that we can, from like an analytic standpoint. But I think from a clinician standpoint, just having some of that information in your back pocket going into that day would be helpful. I mean, in athletes and patients who had a recent concussion, that's one of the things that we see as well, like this ruminating anxiety and potentially higher levels of depression, poor nights of sleep, just thinking about the injury itself can affect the neurocognitive performance and even potentially motor performance too. There's been some interesting research that balance and sway is affected by emotion. If someone's angry that day or they're really stressed, that balance and sway are affected as well. So I think from like a clinician standpoint, just having some of that information as opposed to guessing, that this athlete did really poor today on their reaction time. Maybe they didn't sleep well the night before. Well, actually, having that conversation with them prior to, could say, okay, they didn't perform well that day. Maybe this data isn't particularly useful. Maybe we'll retest them in a couple days, after a good night's sleep or after their big exam or something like that, after some of this like big stressor has been removed from their life. And then you might see more typical performance.
I like it. So I'm thinking about reaction time here. So there's a really simple test, drop stick test.
Yep.
It's quick and it's easy to do. And I'm wondering, it gives you some information about reaction time, but does it give relevant information against lower extremity risk? And if could I use it in the clinic? I mean, right. I've never used it. It's appealing because it's just like super simple.
Right. That's a great question. There's actually been a study published on that recently. Landon Lepke, I think he just finished his PhD at Georgia, conducted a study using the drop stick test and comparing it to more functional measures of reaction time, like during jump landing, jump cutting, and actually found that there wasn't really a relationship between the two. And kind of piggybacking off of that, so one part of my dissertation research was looking at the relationship between computerized testing and whole body visual motor responsiveness during an unanticipated jump cutting task. And basically I found the same thing, that the two weren't necessarily related to each other. in terms of correlation. And I think that gets more into the aspect of, this idea of bandwidth, where if I'm asking an athlete to, as soon as they see a red stoplight, to hit the space bar as fast as they can, they can focus their entire attention on that, and they could probably perform pretty well after a couple times of doing it. But if I tell an athlete, run as fast as you can up to this light, and then the light's going to turn green or red. And when the light turns green, cut to your left. Right turns red, cut to your right. Like, those are two very different neurocognitive processes, because one, we're doing a dynamic motor task, whereas two, compared to like the clinical tests like that, it's very isolated from the different stimulus and stressors that are going on in a sporting environment.
So could you do a study like that where you take someone doing like a t-test, and then you have a version of a sort of an unanticipated t-test where you have to react, and the distance covered is the same, and
right,
like the physical loads are the same, but the how you have to make the movement decisions is different. Is that something that could give you some information about training in that capacity?
Sure. Yeah, absolutely. Whether it's if we're doing like a drill like that, like a t-test, where there's no anticipatory stimulus there, where it's all this like a pre-planned motor task, versus whether they complete the t-test, based on a stimulus. I think that could be an interesting study in and of itself. But it's the idea of clinical measures of like reaction time and cognition versus more like functional measures, in terms of actually, am I responding to a keyboard? Am I responding to a ruler being dropped? Or am I actually responding to other athletes on the field? And my whole body has to make a response now. Because the thing with those tests too is that these tests are upper extremity dominated tasks. I'm clicking a keyboard, or I'm responding up here. But in sports, and relating back to ACL, it's a lower extremity task where I see something, and then that signal has to get sent all the way down to my lower extremity, and the lower extremity has to generate these movements. Whereas this signal is getting sent down, and I have to click a keyboard really fast, or I have to do a finger pinch. That's a very simple motor task compared to, okay, my whole body has to stop, decelerate, cut to the other side, and then I got to sprint forward as fast as I can.
Yeah. So something like a sensory station where you're pushing,
right,
when we push dots on the screen.
Yeah.
Probably can make it more relevant to add in a lower extremity task to it, right?
And actually, a collegiate coach and I pretty recently have been discussing ways to do this in the lower extremity too, to test like lower extremity responsiveness. Because again, a lot of these tests are upper extremity dominated, but doing more reaction time assessments with the lower extremity itself. Again, the data right now is not there in full force yet, but even having conversations like this with you, Matt, sparks a lot of interesting ideas and things that I'm thinking about now from this neurocognitive perspective.
Yeah, cool. Yeah, I just got some. I got some rocks, from A-Champs. They're like fit lights, and those are pretty cool. I mean, they're meant to be like kicked and punched and stuff, and so I was just messing around with them. Oh, no, they really are. I mean, actually, I saw a video of a car running over one of them because they're supposed to be pretty tough. But those are cool because, I mean, today I put them out. My kids were like kicking them around. But that's cool because we were, using our legs to react to the visual stimuli. I don't know if they're research grade though, but they're pretty fun. Well, let me ask you about injury risk. So like what suggestions might you have for a coach who's looking to build resiliency against musculoskeletal injuries? And also how would that advice differ from maybe a rehab clinician?
Sure. I think from that perspective, before we I mean, I think there was another question too, alluding to this, at like what age is appropriate for like sensory motor training and things like that. I think at first we have to build a foundational base from the neuromuscular side of things. An athlete does have to have some requisite amount of strength and skill and endurance, whatever the task may be, whether it's jumping and landing and things like that. So I think as long as there's a good base there from a neuromuscular standpoint, then we can start really exploring some of these like novel technology, strobe glasses, sensory boards, things like that. You don't want to put all our eggs into this basket of, neurocognitive training the brain if an athlete can't even balance on one leg or, can't, do a squat, things like that. So I think from like a coaching perspective and like a, strength side of things, I think there needs to be some sort of base there, from a motor stability standpoint before we start really exploring these, more recently developed technologies. But how that potentially differs from a clinical standpoint is that you could be in a situation where you have a high-level athlete who, unfortunately did have an ACL type of injury, and they're trying to return back to, elite-level sports. This is where I think you could start incorporating some of these aspects into the, the rehabilitation strategies, like the talking point I alluded to earlier with the clinician about, using like virtual reality type of scenarios in the early progression from, ACL, and that, there's not a lot of things that they can do dynamically yet. But being able to have, these quote unquote, like mental repetitions, getting into it like an immersive environment again, where they might not actually be moving yet, but they're actually seeing dynamic movement occur. And it's kind of, re-priming up these neurocognitive processes where they're having to, visually identify different targets and things like that, or, multiple targets in space. And then they start getting, back into, more functional type of tasks. And then, again, keep using these sort of new technology, strobe glasses, things like that. And then, can incorporate that into a clinical practice and see, whether the patient is responding positively. Again, the research yet is just not there yet. Like we talk about this, but there's just not a huge amount of data yet on this topic. I think there will be in the coming years, but we're really we're really at the ground level of just learning about how the brain even affects ACL and lower extremity injury to begin with. I mean, but I think there's a lot of exciting opportunities. So I think that's where it would differ from like a clinical standpoint versus like a practitioner. I just have an athlete beginning in my program standpoint, getting the basics first, and then progress from there.
Yeah. Do you walk into your lab like Monday morning and just like feel like, I don't know, like you're right on the like the cutting edge of this stuff?
Yeah, or absolutely. Every day it seems like we are always kind of discussing like what's coming next, and without getting into too much of the specifics of the studies that we have ongoing right now, I think that the data that we will be putting out there is going to be extremely cutting edge and something that I've never really seen before in terms of like ACL neurocognition, but just some of the stuff that we have lining up in the near future. It's very exciting. We have a lot of great researchers in this lab that are very hardworking and are all very driven to really help athletes and patients and things like that. So the team that we have here is fantastic, and we're very cutting edge. We're always looking for, what's the best way that we can, train an athlete, prevent an injury in an athlete. And I think, this Spark lab is, we're new, we're only like 4 months old at this point, but I think in the very near future, people are going to be hearing about us from all over the place and some of the great work that some of our researchers are doing.
Yeah, no, it sounds awesome. So there are a few questions left. I don't know if you want to have a peek at them and see if any of them like look good to you. I think there's like 6 or 8, probably not enough time to go over all of them, but if any of them look good to you, we can talk, or we could just be done, which should be fine too.
I'm trying to think if I see anything more here.
Yeah. I don't know, because I copied them down. I reordered them. That's why, to make more sense for me.
I saw someone commented, attention is the ability to actively process specific info in the environment while tuning out other details. Google make it not tough.
There you go.
That's
simple,
funny.
huh?
It's a good definition, but I've talked to Harjeev about this too, and he studies attention all the time, and he doesn't even really understand what attention is at this point. I don't really know if anyone really does have a great understanding of it, because I think if we did, I think a lot of the stuff that we talk about right now from this perspective would already have been resolved. We would already have understood this, but I don't think we fully understand attention. Maybe we never will. It might be too complex of a topic for any one person to say that they understand it.
You'll start getting philosophical, I think, too, to really understand it. Yeah, no, I'm going to start asking everybody. That's great.
Yeah, I think it's a great question. I think it's a great question.
Ask Greg Myers. Tomorrow.
Absolutely.
All right. Well, I think if you don't see any more that you want to address, I think we could probably wrap up. This has been super fun. I like this a lot. I think.
It was great.
This is a super fun. This is a super fun series.
Absolutely.
Our hour here has been really, really interesting and fun for me. So I hope it's been good for you. So anyone who's out there would just encourage you to check out Jason's post, our other posts, and we have 4 more posts coming. Next one is Alana Arhos out of University of Delaware, and that's coming out on Saturday. So that'll be a good one. Jason, thanks so much for your time and your energy. I really appreciate everything.
Thanks, Matt. I really do appreciate it. This has been a great opportunity. I appreciate you reaching out and letting me share some of my thoughts. And the other contributors to this series have been great too. There's a lot of really hardworking, very smart people who are working on this topic, and it's cool to be kind of in that field with these people, doing similar work. So again, thanks for having me.
Absolutely. All right. Well, you have a great night.
Thanks. You too.
All right.